We have a question from the audience that's asking about the aspiration when on mother's milk. Can you tell us more about that?
Sure. So most term babies should be feeding well and completing their feeds, and there are certain cues, so to speak, that we teach first time moms, especially how to know whether your baby is feeding well or not. Are they having are they making any? Is there any noise coming during feeding? Like are they grunting, or are they choking during feeding? So those are called like feeding difficulties or breathing difficulties during feeding. Typically, they can be picked up during the newborn period. So within the first couple of days, as you know, based on how the mom has delivered, whether it may be a normal spontaneous delivery or assisted delivery or operational process like a cesarean section. The babies are monitored within the first 2 days. So typically, they are not expected to feed a whole lot, but they should have like a normal pattern, like sucking, swallowing, and latching on to a bottle or mom. So if they are having difficulty, that can be identified right away. But in some situations, they are discharged at 1 or 2 days. So as they feed more, these conditions may be more evident. So that is why follow-up is extremely important with the pediatrician. So, for example, a term baby is followed at around 3 to 5 days. So, it's very important for families to keep track of how much is the baby feeding. Is the baby waking up to feed? Is the baby lethargic or not waking up every 2 to 3 hours? And how much wet diapers or stools the baby is having. So these things are like a basic before discharge. The families are taught. So if they have any of the alarming signs that they can find, like feeding, breathing, or digestive disorders, they need to be brought up to the pediatrician. The earlier, the better. So always we say, like, if moms are concerned about it, we take it seriously. We ask a lot of questions that may point us towards something. Something that is concerning and needs support.
Mhm. Thank you so much, Doctor. And to whoever's asked this question, if you want to consult further with Dr. Lalitha or any of our other doctors, you can contact us on the My American Doctor website for a second opinion or call us on 99 1494 1494. Thank you so much for your insights, Doctor.